enjoy the opportunity to speak about navigation, oncology navigation for optimizing care of older patients, because I think too often we forget that many older people are dealing with a number of health issues, and cancer treatment may or may not be what concerns them most. But what they'll tell you, what older people will tell you almost certainly, is that if cancer care is something new for them rather than an experience they've been through before, figuring out how to make that work in the context of their lives and in the context of what care they're receiving for other conditions can often be a real challenge. So navigating not just the oncology care scenarios, but navigating the healthcare journey with older people and their families is truly critical. So oncology navigators should think about how they need to address older people's needs by first looking at themselves and asking themselves, how gero-competent am I? That is, how prepared am I with specialty knowledge to care for older people? Not how am I able to make this geriatric piece of care work or that geriatric piece of care work, but what's my general fund of knowledge about aging, what older people need for best care practices, and how do I address and interact with older people? Because there are some generational as well as age-related changes that make it important to reconsider how it is we're doing the simplest things, like teaching someone or writing materials for people. After you've considered gero-competence, then you can concern yourself with, how do I put that gero-competence into my overall oncology navigation picture, particularly because more than half of newly diagnosed patients and well more than half of cancer survivors are actually over the age of 65. These people are our primary population, and as such, we should be prepared in the best way possible to offer them more than what they need to exceed their expectations of what cancer care is all about.